You are about to see an animation on the mechanism of action by which Kcentra works. At the end of this presentation, please see important safety information for Kcentra, including the boxed warning. The full prescribing information is available at kcentra.com. In response to vascular injury, physiological hemostasis or clot formation occurs to prevent excessive bleeding. Clot formation is mediated by complex interactions between platelets, circulating clotting factors, and endothelial cells that line blood vessels. Following injury, a provisional platelet plug forms at the site to seal the wound. Meanwhile, coagulation is initiated, a process controlled by various non-activated factors which interact and activate one another at the site of injury. This is known as the coagulation cascade. The conversion of prothrombin to thrombin catalyzes the conversion of fibrinogen to fibrin. Ultimately, the process culminates with the formation of a fibrin mesh and stable clot. When elements of the hemostatic system are deregulated, blood clots, also known as thrombi, can form, potentially leading to thrombotic complications. Anticoagulant vitamin K antagonists, VKAs, such as warfarin, are used to reduce thrombotic risk and prevent thromboembolic events in at-risk patients. In the liver, warfarin blocks the enzyme that is essential for the synthesis of 4 key clotting factors, 2, 7, 9, and 10, as well as naturally occurring antithrombotic proteins C and S. As a result, the concentration of factors available in the blood decreases. Warfarin has a narrow therapeutic window, and bleeding episodes can occur inside and outside the target INR range. This puts patients on warfarin at a higher risk of experiencing a serious bleed that requires immediate treatment. When this happens, patients require immediate replenishment of the clotting factors and proteins depleted by warfarin. Historically, plasma was the standard of care for urgent warfarin reversal. However, plasma contains all coagulation factors in normal concentrations. Large volumes of plasma may be required to deliver enough of the factors necessary for effective warfarin reversal. In clinical trials, patients required nearly 4 units of plasma to reverse the effects of warfarin therapy. Furthermore, transfusing large volumes of plasma can increase the risk of complications, including transfusion-related acute lung injury, transfusion-associated circulatory overload, allergic and/or anaphylaxis reactions. Many patients who receive plasma for reversal of bleeding episodes from warfarin require transfusions that last more than a few hours. In the event of hemorrhage, clotting factors depleted by warfarin can be replenished through Kcentra administration. Kcentra, prothrombin complex concentrate human, is a blood coagulation factor replacement product indicated for the urgent reversal of acquired coagulation factor deficiency induced by VKA therapy, such as warfarin, in adults with acute major bleeding or need for an urgent surgery or invasive procedure. Kcentra is a non-activated 4-factor PCC containing vitamin K-dependent coagulation factors 2, 7, 9, and 10, and antithrombotic proteins C and S. Kcentra restores all of the non-activated coagulation factors and replenishes antithrombotic proteins C and S depleted by warfarin. As the factors within Kcentra are non-activated, this allows the body to activate only what is required for hemostasis. Kcentra is 25 times more concentrated than plasma, enabling rapid factor replenishment to be achieved using less volume and a faster infusion time compared to plasma. Kcentra, the first and only non-activated 4-factor PCC, which selectively restores procoagulant and antithrombotic proteins depleted by warfarin therapy in adults with acute major bleeding or in need for an urgent surgery or invasive procedure.
Warning: arterial and venous thromboembolic complications. Patients being treated with vitamin K antagonist therapy have underlying disease states that predispose them to thromboembolic events. Potential benefits of reversing VKA should be weighed against the risk of thromboembolic events, especially in patients with a history of such events. Resumption of anticoagulation therapy should be carefully considered once the risk of thromboembolic events outweighs the risk of acute bleeding. Both fatal and non-fatal arterial and venous thromboembolic complications have been reported in clinical trials and post-marketing surveillance. Monitor patients receiving Kcentra and inform them of signs and symptoms of thromboembolic events. Kcentra was not studied in subjects who had a thromboembolic event, myocardial infarction, disseminated intravascular coagulation, cerebral vascular accident, transient ischemic attack, unstable angina pectoris, or severe peripheral vascular disease within the prior 3 months. Kcentra might not be suitable for patients with thromboembolic events in the prior 3 months. Kcentra, prothrombin complex concentrate human, is a blood coagulation factor replacement product indicated for the urgent reversal of acquired coagulation factor deficiency induced by vitamin K antagonist, or VKA, for example, warfarin therapy, in adult patients with acute major bleeding, or the need for urgent surgery or other invasive procedure. Kcentra is for intravenous use only. Kcentra is contraindicated in patients with known anaphylactic or severe systemic reactions to Kcentra or any of its components, including heparin, factors 2, 7, 9, and 10, proteins C and S, antithrombin 3, and human albumin. Kcentra is also contraindicated in patients with disseminated intravascular coagulation. Because Kcentra contains heparin, it is contraindicated in patients with heparin-induced thrombocytopenia, HIT. Hypersensitivity reactions to Kcentra may occur. If patient experiences severe allergic or anaphylactic type reactions, discontinue administration and institute appropriate treatment. In clinical trials, the most frequent, less than or equal to 2.8% adverse reactions observed in subjects receiving Kcentra were headache, nausea, vomiting, hypotension, and anemia. The most serious adverse reactions were thromboembolic events, including stroke, pulmonary embolism, and deep vein thrombosis. Kcentra is derived from human plasma. The risk of transmission of infectious agents, including viruses, and, theoretically, the Creutzfeldt-Jakob disease or CJD agent and its variant, VCJD, cannot be completely eliminated. Please see full prescribing information for Kcentra at www.kcentra.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.